Okay, so I want to talk about arthritis for a minute and help get rid of some of the myths and sort of limiting beliefs around successfully managing arthritis, and more importantly, helping to get rid of a lot of the pain that's associated with arthritis, because the pain from arthritis, leads people to stop doing their favorite activities, and it definitely leads people to maybe getting things like surgery, especially total joints, sooner than maybe they need to. And sometimes you can avoid these things altogether. Lots of questions about arthritis have been coming up lately. And, I want to share with you kind of what I tell people. So the first thing is to really understand what arthritis is. We're talking about the osteoarthritis, the kind that you think of when you think of arthritis, aching and stiffness in your joints. It most commonly affects your knees, okay? That's the most common, but it can happen anywhere, all right? So with arthritis, the thing to know is that even as soon as age 40, you can start to see this show up on an x-ray. And why that's important is because most 40-year-olds aren't feeling the consequences of their arthritis yet, or they're not feeling the actual arthritis that's starting to form in their joints. Most people don't start complaining about it until maybe closer to mid-50s, and definitely once they're in their 60s and 70s, okay? So it happens slowly over time, and what that really means is osteoarthritis in particular is a natural part of aging. And that's really important to understand. And when you understand that, you can do things way sooner to mitigate it and get in front of it, okay? Such as making sure that you're optimizing your joint mobility. That's really important. Movement is like lubrication and lotion for the inside of your joints. What gets most people into trouble is when they stop moving. So why that's important is because you need to understand that no matter what that x-ray says, okay, or what that image says, movement is the best medicine for you. Movement and exercise. No matter what study you read, no matter, what kind of research you look at, this notoriously shows up at the top as one of the best medicines, not just for arthritis, but for so many things. Exercise is your best medicine because it builds muscle, keeps blood flowing. We have natural healing agents in our bodies and in our blood. And when you keep all that flowing and circulating, you're doing good things for your body, including the arthritis that's in your joints. And when you have strong muscles, that supports your joints, which will make the effects that happen later in life from just as arthritis advances, it's going to make them less of an issue. So no matter what anyone tells you, one of the worst things you can do for arthritis is to slow down or stop doing things you love to do.